Well, I basically have had this rare skin disease called pemphigitis foliaceus for about 5 years now, and it starts as a blister, and then it pops and leaves raw skin, and then it leaves a scar, and it has a burning, itchy feeling. And I'm 17 years old, and I have a lot of stress already applying to colleges and just doing schoolwork, and this adds more stress. Basically, my question is, am I gonna have this the rest of my life? Is there any solutions?
Well, I'm glad you came here, and I'm glad you asked a question. And before we get to that, I know it's your mom, Lori, sitting next to you. So, Laura, I'm assuming as a mom, it's hard to watch your daughter go through this.
Very difficult. Medications are very expensive, you know, and it's very hard.
You know what would be convenient right now? Is if my favorite dermatologist in the whole world was sitting next to me.
Thank you.
She is.
Thank you for picking her, because I can't even pronounce that disease.
Well, and the fact, honestly, that Lilly, you're having to even know how to pronounce these terms that none of us even learned until medical school says enough. So what do you say? Would you two want to come up here, and Dr. Batra, would you be willing to take a look?
Of course. Lilly, come on up. Lori, come on up. Let's take a peek. Just thinking I'll come around.
Dr. Batra, you can do this. I have all the faith in the world in you.
What I see here are kind of crusted sores. And so with pemphigus foliaceus, this is actually an autoimmune condition. This is nothing you did wrong. This is not contagious. Mom, it's nothing you did either. It's where the body produces proteins against the connections between the top and the middle layer of your skin. And when your body produces those antibodies and starts to attack, then it shears really easily, and you get these very superficial blisters. And those easily get denuded. They get kind of opened up, which can be doorways for bacteria and infection. They can sometimes be really itchy and uncomfortable as well. So you have them here, I see, on your chest and your shoulders. And turning around, I can see that you actually have kind of a flare going on your back. Is this uncomfortable for you, Lilly?
Yes, very.
Tell us about the symptoms. How does it feel?
They're itchy, it burns, it's just really painful. Like when there's clothes pressing against it, it's hard to move. It's even hard to sleep, because if I lay on them a certain way, it hurts and I can't sleep.
I understand you've tried some medications for this. What have you tried?
Prednisone and Celsep,
Okay.
and then other ointments. The prednisone is really hard on her body.
Yes, it makes my bones hurt.
You can talk to me.
And it's hard to move sometimes, like to do exercises, because I feel just weak and very fatigued. And it also causes me to like gain weight. So one day like my pants will fit and then they won't. And it's just really hard to wake up when your pants don't fit, especially being 17.
Yeah, no, I understand. And we can't, unfortunately, cure this as yet, but there are very effective long-term maintenance that can hopefully put this in remission, so you're not always dealing with these really uncomfortable, painful, crusted spots that embarrass you. And especially in olive-toned skin, it often will leave darker footprints that last much longer than the original sores. So the goal will be to prevent these from coming up in the first place. I know, Mom, that it's been really challenging to pay for the mycophenolate, for the steroid-sparing agent.
Yes.
Tell me a little bit about your experience with that.
We first tried it. It worked with her taking a high dose of the prednisone also. And they started tapering off the prednisone, and they would come back sporadically. And then after the first round of the Celsep, my insurance, wouldn't cover it anymore. Then the pemphigitis comes back, and then it's difficult, because then she has to start the whole routine all over again. When she just takes the prednisone, if she tapers off, it doesn't work. She gets major flare-ups.
Well, I think the long-term management goal will be to very gradually taper you down off the steroids and make it sustainable for you to remain on the non-steroid immune suppressive agents, because this is an autoimmune condition. It is something that you're going to be managing for the long term, but I think I understand that it's been such a barrier trying to get this paid for and to manage the follow-up. Yeah. So our goal is to get you on as low a dose and hopefully off the steroids as possible. So we reached out to Dylan Center, CEO of Spective VR, and he's gifting you with $5,000 that you can use towards your medications, treatments, and doctor visits.